Hey, everybody, it's Dr. Jessica Vogelsang with the Veterinary Telemedicine Facebook community, and I am super excited to welcome Dr. Kristen Welch, who is the founder of DVM Stat and also a board certified criticalist, which we need so much in these times where everything seems like it's critical. So thank you so much for
Thank you
joining
very
us here and talking a little bit about what you do. So what I thought we could start with is you run a service that provides specifically teleconsulting, right? So you do not go direct to patients. You're consulting with other veterinarians.
Exactly.
Yep. So can
Yeah.
you explain a little bit about how the sorts of services that you offer can help veterinarians, particularly when we're trying to figure out, okay, this pet, really, they're not in a position to be able to transfer right now. Can I help them?
Yeah, and that's exactly what the whole goal of DVM Stat is really to be able to be that extra connection that the primary veterinarian has with a specialist so that they can continue to provide the highest level of medicine in the safest and best practice way possible while the patient is in their care. And so it can range from anything like a terrible trauma case that comes in that you're working to try to triage and you're looking for that immediate phone a friend help, where you just want to run the case by somebody or get help because the patient's not stabilizing the right way, to something that's a lot more chronic, like a cushingoid patient with diabetes that you've been struggling with for a while and really have been reaching out maybe to your colleagues to try to get some help with, but you'd really love to have an internist who can actually walk hand in hand with you through that case over the subsequent number of months to really provide the best medicine that you can provide because you maintain your veterinary client-patient relationship with your client, and can continue to maintain that patient in your practice without losing them to follow-up.
So, is this something where someone would have to schedule with you, or if it's a trauma, can they just like find somebody immediately who can help them?
Yeah, so we have two different ways that they can get in touch with us. So our 24/7 hotline is a no holds barred call anytime, day or night, holiday or weekend, to get help immediately from a criticalist. And we're fully staffed 24/7 with criticalists. And so whether it's a complicated trauma case, just a sick medicine case, a surgery case that's not doing well under anesthesia, or pretty much anything else, you can call immediately and have a specialist be your phone a friend and get immediately the help that you need with the case right then, but also a really detailed medical report that provides you some ongoing continuing education points too, that a lot of the vets that we work with really love to have that extra information that we provide in the reports, because it acts as a source of learning for that type of case moving forward. And I think the most enjoyable part of being a veterinarian for me is always seeing different permeations of the cases that we see all the time and learning from them so that we become a little bit smarter with every case that we see over our careers. And then the second way to get a consult is just submitting it through our medical record system, which the hospitals will get a email login and password so that they have direct access to all of their current, prior, and archived cases. And you submit your specialty consult request to the internal medicine service or cardiology or radiology, anesthesia, or neurology, to be able to have that case fully reviewed from top to bottom, even if it's the last 6 months of medical records, so that you get a full retrospective and prospective medicine type consult for any of those subspecialties.
And can you just reiterate, because this is a question that I see a lot, how teleconsulting works in the framework of the VCPR?
Yeah, absolutely. So what's nice about teleconsulting is that we are a doctor to doctor consultation service. And so you as the veterinarian maintain your VCPR and you continue to communicate with that client, provide, our recommendations with your recommendations, and maintain that personalized bond that you've formed with that client and that patient. And we act as a outreach arm to that.
What would you say, like if I were to ask you, what's one case that jumps out in your mind is, oh my gosh, that was such a win. I'm so glad we were able to help. Is there anything that pops out?
Yeah, one of the most fun cases that I've done recently was a overnight emergency clinician who was calling because he had a patient that had just this really severe cardiovascular collapse presentation, pale gums, delayed CRT, ice cold periphery, severe tachycardia, and the patient was neurologically inappropriate, obtunded, really dilated pupils, and the patient failed to respond to fluid therapy as he would have expected them to. There was just a scant amount of peritoneal effusion, no pleural effusion, chest rads were boring, abdominal rads and palpation were concerning for a fairly small mass in the mid-abdomen, and ECG was consistent with a sinus tachycardia. And when I took that consult call and we walked through all the different arms of that patient's presentation and the way they responded to crystalloids and some of their lab work abnormalities, like a really severe hyperglycemia, it was most consistent with a catecholamine surge, which is something that we don't see all that often, but like a really cool thing to actually see. And the patient ended up being diagnosed the following day with a ruptured adrenal tumor, which was a pheochromocytoma. So it was a really cool case to be able to kind of walk through from beginning, middle, and then get the end portion of the story the subsequent day after having a catecholamine surge be one of our top differentials.
And I wanted to focus on something else that you had mentioned earlier, which I think is really important about this idea of sort of streamlining not only costs to the client, but being able to retain some revenue for your clinics. And that's going to be a particularly big issue, I think, with everything that's going on right now.
For sure. And I think, that's one of the nice portions of being able to utilize a teleconsultation service as an extension of your primary practice. Not only are you maintaining that bond that the client has entrusted you with the care of their patient or their pet, but you're also providing them that next level of medicine. You're providing them best practice, and you're retaining the ongoing diagnostic testing, the ongoing monitoring, the long-term relationship with that client, and avoiding what often happens where they are referred off to a referral clinic for a consultation, and maybe the client ends up doing all of that follow-up at the referral clinic, and you end up only seeing them for annual or unrelated problems. And as someone who works in a big referral clinic, I see that all too often. We try to send clients back to their primary vet as often as possible, but it doesn't always happen, I think, across the board universally. And this is a really nice way to avoid that loss of client to follow up and to keep that revenue in-house. And you can imagine that when you do a consultation with a specialist, quite often some of the additional diagnostics that are recommended come with a little bit more oomph when you're recommending them to the client. And the client may be more inclined to do those diagnostics when they would have waffled a little bit if it wasn't your recommendation and then someone else's recommendation too. And so you often have a little bit more ability to do a more extensive workup in an appropriate way for that patient, which helps that issue too.
Yeah, it just seems like it's a win-win all around, especially when, both clients and the vets are a little more constrained than they've been in the past. So thank you for having that. I think that's going to be a really valuable service, not only while things are in crisis mode, but after, when people will start to understand what they can do with that. And as a criticalist, I also wanted to talk to you about this idea of teletriage and tele-advice. I think people have this idea that, everything's gray, right? There's never any black or white kind of stuff. And they're a little nervous about having people give advice over the phone. But I'm wondering if you feel like there are a couple do not pass go words. Like everybody knows that if somebody calls and mentions ABCD, like, that that's an emergency and that's not an appropriate telemedicine thing.
I agree. I think teletriage is a bit difficult, and it's something that I think we're all sort of being forced into now with the current pandemic crisis and trying to maintain some appropriate social distancing so that our staff members stay safe. For me, I think the biggest concerns clinically for a patient that's teletriage that would say that that patient absolutely needs to be seen, whether it's by myself or the veterinary hospital that's closest to them, would be things like collapse, respiratory distress, severe pale gums, neurologic abnormalities, or a patient, like a well-regulated diabetic patient that suddenly is mentally inappropriate, really lethargic and down. Um, there are certain toxicities as well, as we all know, things that we don't want to just recommend inducing emesis at home with, things like ingestion of batteries or caustic chemicals, zinc phosphate toxicity. I had one of those last week. So there are definite things that are the, stop, put the brakes on, and that should be a patient that really truly can't be just triaged and managed over the phone.
Yeah, and I think that that's going to be something that's so important sort of moving forward, is that people have at least enough confidence to do some of those baseline things first, because I know my concern is always that when they go to Dr. Google, they're not they're not saying the right things, right? They're saying vomiting, and somebody gives them a response like, "Oh, just give them some chicken and rice." It's like the dog's bloating. We
Yeah,
want them to contact us first.
for sure. And I feel like what's really nice about the teletriage and telemedicine is when it's coupling communicating with the client with video of the pet. A lot of times the subtleties that are included in that telemedicine workup that now a lot of primary veterinarians are using as a big portion of their practice, the video I think helps so much. I have clients bring me videos all the time, even when they're coming in for a consult, because there's a behavior or an action that the pet's doing at home that we know I'm not going to see in the room because it's Murphy's Law. But I think video teletriage is just going to really help to iron out some of those inconsistencies and the owner's ability to describe what's actually
Yes.
happening accurately.
Ah, yes, the ever-present constipated cat.
Yes,
Right?
for
Like, oh,
sure.
well, perfect. Thank you so much. Is there anything else that you think is really important for people to understand, or things that would sort of help them be more comfortable with what's coming up ahead that I forgot to ask about?
Yeah. Well, I think what's, part of, if we have to find a silver lining in all of this really scary time that we're in right now, financially, health wise, and worldwide crisis wise, I think the silver lining is that veterinarians are being forced into kind of pushing the boundaries of the type of practice that we're all used to doing every day. And so by starting to incorporate things like telemedicine and teleconsultation and teletriage, there are a lot of ways that we can actually, in the long term, once this is far done, improve our productivity, decrease our overall stress level by being able to sort of allocate tasks out to some of our staff members, and ultimately improve our work-life balance. So I do think that, ultimately something good can come of what we're going through right now. What's really nice to be able to do is to be able to see if we can continue to maintain the same level of medicine and the same level of practice while using telemedicine and teleconsultation to help bridge that gap, because there aren't many referral hospitals that are able to accept incoming new consult patients or more elective type of workups. And so this is where a group like ours is able to help bridge that gap, and you can continue to provide the level of medicine you would have provided in your hospital and in your clinic during this time, but are able to do it in an appropriate social distancing way, where your client still works directly with you and maintains their trust and bond with you, but you're utilizing and leaning on a specialist who works with you now during this period of time, but continues to be available to you for months and years down the road. We track a lot of our patients for years, and you get that same specialist who's continuing to work with you on that patient's case. So it's as if you have your own internist that you're directly working with, or your own cardiologist or neurologist or radiologist. It's really nice.
And then that actually reminded me of one other point that I'm very curious to see how this plays out and sort of what your opinion is. I think Michigan had just passed a requirement that veterinarians, and they very specifically defined, like, you can only do emergency services, you can do ABC, and you can't do D, E, and F. And to me, one of the big applications that hopefully people will use with telemedicine right now during the emergency is this idea that however much you can handle that isn't an emergency using telemedicine sort of clears the runway for the ERs right now so that they're not sort of overwhelmed.
Absolutely. Yeah,
Yeah.
I think there's a lot of cases that, um, that do lend themselves to being able to be sort of triaged and assessed in a telemedicine kind of way. And the ERs for sure, our ER has been inundated, and
Yeah.
our general practices haven't really even closed in our area, but they've cut down on things that are considered elective. And so they've limited their days appropriately and are shortening the number of patients that they see during the day. But our ER has completely exploded with cases, and I expect that to continue to progressively worsen. And so, teleconsultation is not just for general practitioners, or not just for referral clinics that are missing one or two of the specialists. It's really for everybody to, so that we all are able to continue to offer the best and highest level of medicine to our patients in a way that is affordable, convenient, and doesn't break the VCPR that the primary veterinarian you has built with your patient.
Yeah. And there's so much we can be doing. There's so many discussions about VCPR. And what I keep coming back to is this idea that regardless of whether or not we're allowed to establish a remote VCPR, like that doesn't really matter because there's so much, like the biggest application is in what we do with the clients we have right now.
Exactly. That's what I was
Focus on
just
that.
going to say. Yeah, those patients that you continue to work with, that you've had a bond with, that you've been working with on their, Cushing's patient, their diabetic cat, their patient who's got chronic renal failure and hypertension. Those are the patients that we want to continue to maintain that veterinarian client bond with, even in the times where we truly are social distancing and not seeing them directly. You've already established the VCPR with them. So I know right now there's a lot of concern about, can you establish a VCPR with a new client? But I think one of the most important parts of maintaining business right now is maintaining that business with your clients, your client base that you've already built up. And telemedicine really lends itself nicely to that because you've already examined that pet, that client, you've had conversations with them. And for those patients that have chronic issues or have developed new issues, being able to roll in consulting with a specialist to give that owner that extra level of confidence and moving forward treating that patient with X, Y, or Z is a really nice way to combine teleconsultation with telemedicine in maintaining your patient base that you've worked so hard to build up.
Yes. We're all in this together.
Yeah.
There's so many different tools now we have. So if somebody is interested in learning about you guys, where should they go?
You can learn more on our website. It's www.dvmstat.com. And our telephone hotline is available 24 hours a day. It's 833-386-7828. And you get a doctor on the phone immediately to talk and walk you through a case.
Perfect. Well, thank you so much. This has been really, really useful. And hopefully the group will get some good information out of this as well.
Great. Thank you for having me.
Yes, thank you.
All right.